Okay, we did seizures for our video project. So seizures is when there's enough normal electrical activity in our brain. So this causes changes to us physically. We won't be able to control our muscles. We go ahead and go unconscious. Sometimes we lose our memory. Sometimes we don't. They can be provoked or unprovoked. Some of the provocations could go ahead and be whether you hit your head, you recently had exposure to toxins, sleep deprivation, things like that. The list is very lengthy. Somebody that is going through a seizure, they're gonna have muscle jerking. They're possibly gonna go ahead and lose their bladder and bowel control. Somebody that's starting to go ahead and get the seizure, they might appear fearful, blank stare. They might start even mumbling. Once they regain consciousness, they're gonna go ahead and be fatigued, and they might be confused. They won't remember, or they might. Some things that you want to go and watch out for in history. Go ahead and see if there's hypoxia, hypoglycemia, fever, drugs. Ask them about if they have discontinued a drug all of a sudden. Vital signs can going to be like pupil dilation, sweating, face flushing, heart changes. They might feel palpitations without actually the heart rate changes. With the tools that you might read that some uncommon ways that you can go ahead and find out if they have seizures. They have tingling in their arms, intense fear or joy, twitching of the body, things of that nature.
So red flags for seizures are going to be if it's their first seizure, or if you don't know the cause of the seizure, if there's anything in their environment that could be potentially dangerous, that'd be a red flag, such as if they were driving or if they're in a body of water. Also, if they're an infant or a child, or if they're elderly, because the chance of having a stroke with a seizure increases by a lot over the age of 60. So looking at the different categories, we have generalized, which generally involves the whole brain, and partial, which involves part of the brain. The generalized, you're going to have the grand mal seizure, the tonic-clonic seizure, the major motor seizure, and the convulsive seizure. Partial, you're going to have the partial simple seizure, where they still have their sense of awareness, and then the partial complex, where they have an impaired or lost sense of awareness. Possible complications for this, really damage to the body, stuff like fractures, burns, contusions, stuff like that is really bad. That's why you really clear the surroundings for someone when they have a seizure. Aspiration may also occur, and that can be a large complication, so status epilepticus. And really, like, whenever we see these complications, these red flags, getting EMS to the scene as quickly as possible is very important.
So for my patient here that's having an active seizure, I do first want to call EMS.
Call 911.
I want to make sure that nobody's crowding my patient and that all furniture is out of the way so that they don't hurt themselves. I'm going to first roll them on to their side and place something soft under their head so that they don't hurt themselves, and so that if they do happen to throw up or there's fluid in their mouth, they're not choking on it. When EMS does get there, a great hospital or facility that I would think would be great is UT Southwestern ER. This hospital actually accommodates for epileptic types of seizures, and I think they'd be well equipped to handle this. I suspect that when my patient does get there, they would run an MRI, definitely neuro tests, blood tests, EEGs, and depending on the provider, a spinal tap. Some differentials for this could be movement disorder or psychogenic non-epileptic spells. Psychogenic non-epileptic spells are attacks that may look like epileptic seizures but are not caused by abnormal brain electrical discharges. Instead, they're actually manifestations of a psychological distress. And for a patient having movement disorder, this is often abnormal movements that the patient experiences on a daily basis, whereas seizures are characterized by some type of traumatic or stressful event.